One of the biggest things that I see anytime that I see a patient for joint discomfort, and I usually mention it on the first time that we see each other, is try to restrict the amount of processed foods and particularly white sugar. We know this for a long, long time. Processed foods are full of bad nutrients that create inflammation, but also they don't necessarily help with our weight management either. There are a lot of empty calories there, and the same goes for sugar. Other foods, including high levels of alcohol intake, red meat, and we already mentioned nightshade vegetables can be problematic. Now, at the end of the day, every single patient is an individual and needs to be treated individually. So there are other things within people's diets that can cause a problem for one person and not a problem for the other person. So gluten, many people have gluten sensitivities, which can not only cause upset stomach and GI distress, but can also cause joint discomfort. There are blood tests that can be checked, and you can see a gastroenterologist to determine that. But many times patients just discontinue gluten from their diet and they start feeling better. And so that's something that can, in a certain patient population, be a bad thing for their joints. And also sometimes dairy products can be an issue. At the end of the day, anytime that we are avoiding specific nutrients within our diet, it is important to acknowledge the essential elements and nutrients that are within those foods and get supplementation otherwise, especially if they're negating and purposely avoiding large groups of food.